the right for disabled people to make intentional communities. So I don't know, at least I've heard autistic people saying like, we should get together and make our own city of like our own country of just autistic people. I totally agree. You know, and what's the big reason? Why haven't people done it? Because it's so darn expensive. And the biggest thing is permitting, right? Permitting and codes. Because, you know, I think it's relatively easy to, you know, build a shack, you know, insulate it, have composting toilets, you know, set up solar panels, all that. Yeah, some of those things are expensive, but it's like way less expensive than building, you know, an apartment complex or like housing or like setting up a city sewer or like, you know, a city power plant. You know, there's cheap alternatives to these things. And you're not allowed, because they want you to pay as much money as possible and never stop paying and just pay a lot of money because they want all your money, the government and rich people, and you're not allowed to get away with cheap free things, especially housing. So the right for people to organize and have their own, create their own intentional communities, cities, their own intentional cities or countries. There's so many resources on how to build those things, and I want to build that. I want community with y'all. Next one, client-owned assisted living facilities. Before I get into that, I'm going to say, so for a lot of for homelessness services, a lot of people eventually find themselves in these places. They're called independent living facilities. It's basically it's usually like a house, and it has you know, people are just like in different rooms. What is it? Single room occupancy, SROs. That's more like a dorm type environment, but or, you know, college dorm environment. But in the individual in independent living facilities is kind of like the house version of that. But we need, for those facilities, we need everyone has the option to have a caregiver, because a lot of times people who need to be in a boarding care, they don't have enough beds, and so they go to independent living facilities even though they are not independent, and that causes so many problems, and people are not being supported, and it's not a good situation. And so all independent living facilities, there's access to a caregiver. You know, and they don't have to be on site. You know, it could be like maybe an on-call thing, right? They use the house phone and just say, hey, I need someone. And then you know, it's not like a scheduled 4-hour shift. If they only need 10 minutes of help, that's great. And then the caregiver can help someone else. Yeah, and back to the idea of like the Uber help thing, like have caregiving services like that where you can just like, you know, call someone whenever, literally anytime when you need, you know, Uber caregiving. And it doesn't have to be a 4-hour shift. It can be just, you know, a real short time. Okay, yeah. Client-owned assisted living facilities. So you know, assisted living facilities, boarding care, they're not good places. And why, right? Because they are a lot of times they're run by able-bodied people, right? And they just want money. They don't care. And so we need clients to be the ones who are running things. And so so I kind of like, what I kind of imagined for that is so this was kind of inspired by this organization called Moishe House, which is for young Jewish people. It's subsidized housing, and basically you can either apply to an existing house, or you can get a group of Jewish friends and apply together, and they get a monthly stipend. And so I thought, you know, the same thing could be done for disabled people, you get a stipend, and with that stipend, you hire your own caregivers. And real quick before I end off, I'm going to backtrack to the for the independent living facilities. There's a lot of people who use those services who struggle with mental illness, and a lot of these people, really need to be on their medication, and pharmacy system is so it's literally like a part-time job. That is how difficult it is to get your medications and get them on time, and so we need to absolutely reform that system, and also have a caregiver specifically for medication, and their only job is to assist with medication. They get the prescription, they get it from the pharmacy, they hand it to the client. If the client needs needs help every night, if they need someone to show up every night, or if they have insomnia and they're not sure when to take it, they can they have someone they can text or call hey, I'm gonna take it now. Is this to make sure they're not taking it too much or too little. That would also and that would also super help for people with memory loss, where it's I don't know, I don't know if I'm taking it, I don't want to overdose. Just having a caregiver specifically for medication, if they're again, that's if they're doing it the daily dose with them, that's a 10-minute a day thing. That's so much of the caregiving, it's 4-hour shifts, and that is just if someone only needs help for 10 minutes, that's unreasonable. But yeah. Next one, all doctors need to, or most doctors anyway, need to have the option of doing home visits, or honestly, all medical care, having the option to do home visits, and also to expand access to palliative care. Palliative care is basically hospice, but for people who are not terminally ill. Both of those things that I just mentioned significantly reduce hospitalizations. Social service distribution. Right now, we have 211, which I don't know about the 211 in your city, but from my experience, they give outdated resources. And that's actually a very common thing, kind of everywhere where, even community based, community created resource lists, sometimes the information is out of date in 3 months, because there's high turnover. Sometimes programs shut down. There's so many different reasons, but this would be a website. So I don't know if you knew this, but there's a lot of 211 organizations that have, and these are separate organizations, by the way. So there's a lot of 211 organizations that have that on their website. You can search for. There's a search engine. You can search for services. Again, in my area, it's outdated. This social service distribution would be one-stop shop for everything. So this would be a single mass community resource list and search engine with detailed listings and regularly updated listings. You could have accounts, and this would be one intake, and that is the one intake you have forever. You update it as things change. On your account, you have one to-do list of all the services you need, all the things you need, so that your case manager, whoever is helping you, they see that list and they know what they need to do. You don't need to repeat your story to other employees. You, on your account, get to see your file. You get to see your file. You get to see whether organizations are reporting things accurately. And it's also a place to file grievances, because a lot of times information to file grievances is in fine print, usually on the intake paperwork. And so it's not something people know that they can do and how to do it. So it would be a place where you can file grievances and you can see that. This would kind of be a systemic change as well. So right now, social workers, they have a lot of, there's different systems, right? Whether it's a different set of system for the city, a different system for the county, for adults, for youth, and that can, if you're in the, 16 to 24 range, that can get messy. And if, you're disabled versus homeless, and it's just like so many different systems that are constantly changing too. So poor social workers, like teachers, cannot keep up. And it's so many different ones. And so this would be one single system, because then also social workers from different organizations can also collaborate. That would be really helpful. Oh, and with that, clients would be able to opt in and opt out of services. Sometimes, services, they'll like require you to see a psychiatrist. But okay, what if you already have a psychiatrist that you're saying that you like? Or what if like you don't need a psychiatrist and you just want to see a therapist? But the program, it's therapy and psychiatry, and so this would be opt in and opt out. And then with that, funding would go to social service. The funding for social services would be redirected to people who need it. It would not be, a repetition of, things, people don't want, but, they needed this one part of the program. Next up, we need more privacy for around disability accommodations, and we need those accommodations to be taken more seriously. So with a lot of disability accommodations, whether that be, 504 plans, IAP plans, or just, even like in a hospital setting, there's a lot of times where like the paperwork is like super oversharing to, people you may not necessarily want, in terms of like diagnosis stuff, people you don't really want knowing. It's like a really serious privacy issue. And so we need to be able to communicate these disability accommodations and have them taken seriously. Because so many like nurses, so many medical professionals have never heard of what an invisible disability is, which is like, you are a medical professional, you should know this. But yeah. Anyway, so yeah, just basically, it's high privacy, taken seriously, because people will have the training to know what it is, or they get trained or something. Next one, everyone in public school learns the 100 most common words American Sign Language. You're not necessarily going to have, really good conversation with that, but it would help a lot with, basic day-to-day stuff, and especially like emergencies. We need jobs specifically for disabled people. So we need someone to just like assess like all the different industries, all the different businesses, and assess what jobs can be done by a person who's disabled. And I think a lot of these jobs should go on a website that's like similar to like Uber, where it's like incredibly flexible hours. And one of the big problems with apps like that, Instacart and similar apps that's like flexible hours, for a lot of those, it's like if you don't work a certain number of hours a week, the app will stop sending you notifications for jobs or job listings, and that is like very frustrating because it's like you join the app so you wouldn't have to do that. But anyway, we need an app. Next thing, meal deliveries. So in the US, for the amount on your EBT card, you should be able to pay for this with EBT SNAP. You get as many meals as you want delivered. Then it fills all your nutritional requirements for that month. They are according to your medical diet, your dietary restrictions, your culture. So if you eat like a specific cuisine, like they make it in that. Either accessing or attempting to access disability services, social services, and healthcare services in general are disabling. Those are very disabling. The system itself is disabling. Fighting the system is disabling. It needs to be a safety net and a healing space, and not something that you're fighting, and not something that is harming you. Like you need to integrate mental health and physical health. Like you can't, like all these services and hospitals are, there for healthy people having stereotypical problems. They're not for anyone else. And a very large portion of the population is left out there. In fact, I think that if a hospital cannot treat you, they need to pay, I don't know, like $10,000 or even more to fund the building of a hospital that can. The current mental health system is equivalent to modern day bloodletting. Like, there are so many aspects of the mental health system that actively make your mental health problems worse. Easy example is hospitals. We've all heard about how, a lot of us have heard about how the long-term hospitals shut down, years ago, in large part because of the absolutely horrific conditions. And those conditions have not changed in psych hospitals in the U.S. I have seen some very horrific things, people being abused in some incredibly horrific ways. It is equally as bad as it was before. I'm not going to give more details. Don't want to trigger people. Next up is prevention of disabilities. There is a very large, significant portion of disabled people who either their disability was preventable or the severity of their disability was preventable. Next thing, recognize ABA therapy as equivalent to conversion therapy and ban it. This is going to be a long series, so buckle up. Call to protest. Here are some demands. Ending segregation. We currently have segregation against a variety of people, but I'd say the biggest one are people with disabilities, both visible and invisible disabilities. And a lot of people, who bring this up say it's about not being wheelchair accessible, which is a very important topic. We absolutely need to work on, we're getting ramps for stairs, threshold ramps, elevators. But one thing that people don't talk about is literally not being allowed to use services or even enter buildings. If you try, people saying, if you try to enter this building, we will call the cops on you and you will be arrested. Usually they say causing a public disturbance. This is not it's not just about not being wheelchair accessible. This is you are not allowed here.